How did you get involved in this work?
I got into this role. I was fortunate enough to work for a Catholic healthcare organization about 6 years ago, and they incorporated me to be a part of the community, give back to the community, and one of those things is they had a coalition in the community that I knew very little about when I started, and the community did as well. We got going more and more, and it had to do with reducing drugs and alcohol. Being a dietitian background, with healthcare prevention, just in general, of course this was important and near to my heart. I was happy to be involved. With this, then I got to do community outreach, got to work with other colleagues, got to work with the schools, government, and that led me to my current role now where I work in Roseau County with Team EPIC, and I play a similar role there as a clinic manager about incorporating in healthcare and what we can do to help our community with prescription medications, diversion, etc.
Tell us about your coalition.
I've been in the coalition for about 2 years. The coalition started in 2013. Primarily for myself, because my specialty, the field I work is healthcare, we work with and look at prescription medications, about drug diversion, overprescribing medications, what we can do to help minimize those drugs that get out in the street for prescription medications, which of course are needed under physician's orders, but what areas are they not needed in and how could there be abuse of those? So that's the primary focus for myself being on and part of the coalition.
Tell us how your role as a healthcare provider and a coalition volunteer help prevention.
It's an exciting opportunity for me to be a part of the coalition because I can bring a different background rather than the quote-unquote street drugs or tobacco, alcohol, etc. Looking at it with the new phase, sorry to say, but the epidemic that's coming through with prescription medications, about how do we minimize that. So that's the role I try to bring. I work with our physicians and healthcare providers to communicate back and forth. I can be their voice to the coalition about concerns they have and bring it to the coalition, trends that they're seeing, and also bring back information to the healthcare team about trends that the community is seeing, worries, and advice that they have, and different measures we have or maybe would put in place in the future or have already in order to help minimize these. Such as currently we use a pain contract. So with certain narcotic medications, etc., we have a contract with patients when they're on this for a long period of time that as a chronic use, then we have a contract in place that they have to follow certain measures, and really if they fail that contract, they're agreeing that they could be let go from that practice, so that helps keep things in check. One of the exciting things about my role is that being on the coalition, it's a win-win for the clinic and the healthcare providers I represent and am a liaison for. It's a win-win because I get so much information I can bring back to them, and then I also have feedback and information I can bring back to the coalition. So it is really a nice partnership and relationship that I don't feel that when I go to the meetings and contribute that that's it. That's a nice warm fuzzy feeling and a good feeling about being a healthcare professional, but it's great when that comes back as well, things that I can bring forward. So it's not just giving, but it's also receiving. That's a great opportunity, especially in a small town.
How do you think sharing this will help others?
I think sharing this with others, for my role right now, is I'm a good community member in the eyes of a small community. So face recognition and name recognition and your title helps a lot. So when they can see that, they can see that the healthcare organization in town is involved, in the community is involved. That's one big step already. And then you see the schools there, ministries there, governments there, law enforcement's there, about bringing the specialists together. I have a specialty. Everyone at the table brings something. And I think it's vital for all to be involved. Really, everyone should have a voice. Everyone has feedback, even the aspect of the parents at home. Having them be a part of it. They're the ones with the children. They're the ones, the feet on the ground that have the passion behind it. We're here with the expertise to help bring it forward. That's part of a coalition. That's what's exciting because you can bring the whole group together.